Hello, this is Dr. Gil Wilshire of Missouri Fertility in Columbia, Missouri. Today's obviously a surgery day. We're going to be talking about miscarriage. About half of all pregnancies don't survive, and once a clinical pregnancy is recognized, it'll fail perhaps 22 to 23% of the time. When it fails, it becomes a miscarriage. Now, if pregnancy tissue passes on its own, nature takes care of itself and everything is fine. In that way, blood loss is minimal and chance of infection is low. However, if pregnancy tissue does not separate from the wall of the uterus properly, sometimes it needs some help to come out. That procedure is called a DNC, or a dilation curettage. It's very, very common. In our office, about a third of all pregnancies will fail, so unfortunately we have to do a lot of DNCs in this practice. Now, a DNC needs to be done properly. Like holding a bird. If you hold it too tight, you hurt it. If you hold it too loose, it flies away. When we do a DNC, we have to clean out the uterus very carefully, thoroughly, but gently. That's very, very important. And that type of skill only comes from doing many, many of them. When we do a DNC, we also evaluate the inside of the cavity of the uterus, make sure it's smooth. We're looking for lumps or bumps or congenital anomalies, which might also contribute to the risk of miscarriage. We want to get this tissue out so it does not become infected. We want the uterus to be able to heal and return to normal. So hopefully we can get back in the saddle and ride and establish another pregnancy, hopefully in the not too distant future. We can usually start trying in about a month or so. So that's our basic understanding of miscarriages and DNCs and why we do them. I hope that's helpful to you. Once again, these are generally sad events, but the silver lining of a miscarriage is we did at least get a pregnancy started. A lot of good things had to happen to establish a pregnancy, and usually if we tune things up and try again, we have a good outcome. So once again, thank you for your attention. This is Dr. Gil Wilshire at Missouri Fertility.